Hi, I'm Kimberly, Dr. Schauland, and today I'm going to walk you through how to do a lid massage following your hot compresses. So immediately after you've taken off your heat mask, we're going to go ahead and excrete out the loosened materials. So remember, the glands run up and down vertically along the upper and lower lids. And with that heat mask, we just took that toothpaste consistency and melted it down so it can be more like the natural olive oil consistency. But now that we've melted that down, we need to excrete it out so the good olive oil consistency can fill back in and giving you symptom relief long term. So immediately after that hot compress comes off, you're going to take a clean finger, and with your eyelids closed, we're going to push down across the lid, trying to excrete the contents from those glands. The motion needs to be vertical, or the pressure needs to be vertical, up and down. We're not pushing into the eye because we don't want to damage the actual ocular structures. And then lastly, we're going to kind of squeegee across to really get the rest at the opening of the eyelashes where those glands open to come out. Then we're going to look up and we're going to do the bottom lid. So we're going up and down across the lid, and then do that last squeegee across. Blink a few times, and it's normal for us to have a little bit of blurry vision after because we excreted that incorrect material, and that can kind of make us a little blurry. And then again, we're going to do the other eye the exact same way.